Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. My name is Dr. Vidya Sundareshan, and I'm Professor and Chief of Infectious Diseases. Today, I will be discussing pre-exposure prophylaxis, also called PrEP, for HIV prevention. This video is for informational and educational purposes only. It's not intended as medical advice and should not replace consultation with a qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any questions you may have about your health or a medical condition. Pre-exposure prophylaxis, also called PrEP, is a safe, effective prescription medicine that can reduce the risk of getting HIV by as much as 99%. PrEP is given to people who have been proved to have a negative test for HIV and have certain other risk factors for acquiring HIV. Talk to your healthcare provider about PrEP or use the HIV services locator to find a provider near you who can prescribe PrEP. What is PrEP? PrEP, or pre-exposure prophylaxis, is medicine people at risk for HIV take to prevent getting HIV from sex or injection drug use. PrEP can stop HIV from remaining and spreading throughout your body. Currently, there are 2 FDA-approved oral medications for PrEP, which can be taken daily. There are 2 other FDA-approved long-acting injectable forms for PrEP. One that is administered every other month, and the other is administered twice yearly. What drugs are approved for PrEP? PrEP can be pills or shots. There are 2 pills approved for daily use as PrEP. They are combinations of 2 anti-HIV drugs in a single pill. One is called Truvada. Truvada is a combination of 2 medications called emtricitabine and tenofovir. This is for people at risk for HIV through sex or injection drug use. Generic versions are also available. The other medication is called Descovy. Descovy is a combination of 2 medications called emtricitabine and tenofovir alafenamide. This is for sexually active men at risk for getting HIV. Descovy is not for women who are at risk for HIV through receptive vaginal sex. 2 long-acting injectable forms of PrEP have been approved by the FDA. One is called Apretude or cabotegravir. This is for adults and adolescents at risk for HIV through sex who weigh at least 77 pounds or 35 kilos. It's an injection that can be given by your healthcare provider every other month instead of a daily oral pill. This is given in the muscle of the buttock area. The second injectable is called Yes2Go or lenacapavir. This is for adults and adolescents at risk of HIV through sex and weigh at least 77 pounds or 35 kilos. It is an injection that's given by your healthcare provider twice yearly instead of daily pills. The starter dose includes oral pills taken for the first 2 days to get the medication concentrations in the body up to protective levels quickly. Who should take PrEP? PrEP may benefit you if you test negative for HIV and any of the following apply to you. If you have had anal sex or vaginal sex in the past 6 months and you have a sexual partner with HIV, especially if the partner has an unknown or detectable viral load for HIV, or you have not consistently used a condom or have been diagnosed with an STI in the past 6 months, or you inject drugs and have an injection partner with HIV or share needles, syringes, or other injection equipment, or you've been prescribed PEP, post-exposure prophylaxis, and you report continued risk behavior or have used multiple courses of post-exposure prophylaxis. You may choose to take PrEP even if the behaviors above don't apply to you. Talk to your healthcare provider. If you have a partner with HIV and are considering getting pregnant, talk to your doctor about PrEP. PrEP may be an option to help protect you and your baby from getting HIV while you try to get pregnant, during pregnancy, or while breastfeeding. Why take PrEP? There's no effective vaccine to prevent HIV, and PrEP is highly effective at preventing HIV when taken as recommended. PrEP reduces the risk of getting HIV from sex by about 99%. when taken as prescribed. Among people who inject drugs, it reduces the risk by at least 74% when taken as prescribed. PrEP is less effective when it isn't taken consistently. It's therefore important to stay on PrEP. If you decide to stop the medications, you must talk to your provider. If daily pills are not desired, then non-daily, event-driven, or on-demand PrEP may be an option to take only when there is a high chance of getting HIV in an encounter. Is PrEP safe? PrEP is safe. No significant health effects have been seen in people who are HIV negative and have taken PrEP for up to 5 years. Some people taking PrEP may have side effects like nausea, diarrhea, headaches, fatigue, and stomach pain. These side effects are not usually serious and go away over time. If you are taking PrEP, tell your healthcare provider if you have any side effects that bother you or that do not go away. And be aware, PrEP protects you against HIV, but not against other sexually transmitted infections or other types of infections. Combining PrEP with condoms will reduce your risk of getting other STIs. How do you get PrEP? If you think PrEP may be right for you, visit your doctor or healthcare provider. PrEP is only available by prescription. Any healthcare provider licensed to write prescriptions can prescribe PrEP. A specialization in infectious diseases or HIV medicine is not required. This includes pharmacists in a growing number of states who can prescribe PrEP. Because PrEP is for people who are HIV negative, you'll have to get an HIV test before starting PrEP, and you may need to get other tests to make sure it's safe for you to use PrEP. If you take daily oral PrEP, you'll need to see a healthcare provider every 3 months for repeat HIV tests, prescription refills, and follow-up. If you use injectable PrEP, you'll need to see a healthcare provider every 2 or 6 months for an HIV test and the injections, depending on which option you choose. If you do not have a healthcare provider, you can use the HIV services locator to find a PrEP location and other HIV services near you. You can visit community health centers for PrEP services that have sliding scale fees based on your ability to pay. There are more than 15,000 health centers nationwide. Pharmacists can also prescribe PrEP in Illinois. Some other states where pharmacists can prescribe PrEP include Arkansas, California, Colorado, Maine, Nevada, Oregon, Utah, and Virginia. Is PrEP covered by insurance? Yes. In most cases, the cost of PrEP medication and services are covered by health insurance plans, Medicaid, and Medicare with no out-of-pocket costs. If you don't have insurance or Medicaid coverage, there are other programs that provide PrEP for free or at reduced costs. Programs like copay assistance programs and VivConnect can help lower the costs of PrEP medications and pay for PrEP shots. PrEP assistance programs can cover PrEP medications or cover clinic visits and lab tests in many states. Some programs cover both. To find out more, please visit the website listed in the reference section near the end of this video. Thank you for accessing this video on PrEP. If you have any questions or concerns regarding your health, please contact your healthcare professional. The Office of Correctional Medicine at Southern Illinois University School of Medicine invites you to explore more educational content in our Health Matters series.